Hey guys, so I was asked about swelling, in particular seromas, and if there was a treatment. So seroma is usually a collection of fluid that maybe the body will drain on its own and it's just going to kind of go away. And sometimes it doesn't, and it needs to be needle aspirated by your doctor. So this one woman had plastic surgery and she has a seroma and is waiting for the doctor to go ahead and drain that, but she's having a lot of pain and she's concerned about it. So I had brought up taping as a possible option and she asked for a demonstration. So that's what I'm going to do, is demonstrate it. So I'm going to really try to demonstrate taping for fluid live right now. I've never done it before and I really didn't practice. So I'm going to pretend like that's my seroma. So you can get Kinesiotape pretty much in every store. It's very popular right now. I happen to use rock tape normally, but you can get anything. And if you're just kind of trying something out, I would just go to your local store and kind of try it out. So there's kind of two different taping methods that I would basically use. And I'm using like this huge giant roll, but some of them come in pre-cut strips. So there's two different ways you could kind of approach it. You can make an X over it. So in that case, I'm going to take a little bit and I'm going to fold it over and cut it like that. So this will end up being the two pieces of the X. And I'm just going to round the edges because my strip isn't rounded. If you can hear me, let me know. All right, so I basically got two strips. And what I'm going to do is go across it, just like that. So this is kind of like a Band-Aid. The paper layer will just rip and you pull it back like that. There's automatically some stretch in here, but you can give it a little and then you would just put it over, pull it down. There you go, that's one. And then the other one, same thing. Now tape usually lasts 3 to 5 days. Usually it's well tolerated. There's not really anything in the tape, so it should be okay. And for those of you, something like that, those of you that are recovering from a plastic surgery procedure and are wearing the compression garments, or anybody else that's wearing a compression garment, you can wear this underneath. So it's something to think about. You could leave it on. If you're wearing it under a compression garment, it might not last that full 5 days. So that's one option, right? We're making X. It's probably the easiest way, like almost anybody can do that. So that's a good one to try. Now, it doesn't mean that this is going to completely drain the seroma. I don't even know if it would really work, but it's a way to stimulate the lymphatic system and get things moving. So, you know, if you're having a lot of swelling in that area, if you're doing everything else, but you've just kind of got this issue going on, maybe in between your lymphatic drainage massages, this might be something that you could do to kind of help speed things along. So the other way is a little bit more complicated. So you'll take your, I did one piece like this, and I'll do the piece that it'll match. Again, we're going to kind of do two pieces of tape. I'm just making another one kind of the same length. So again, we're going to round the edges. And now I need to cut these fingers. So let's see. All right. So you do 3 or 4 Just kind of depends on how you make your first cut and how it works out. But essentially, you're going to be making a basket weave of these fingers. You're going to weave them together, and I would weave them together over the area in question that you're worried about. Now, if you're talking about something in the abdomen, I'm just kind of using that because that was the person's example. Anything above the belly button will be draining into the axilla, so we want to kind of encourage it to go this way, so you can draw your fingers that way. Trying to get under the breast, fit everything in there. If it happens to be lower, then you want to go more towards the inguinals. So that's where I would kind of drag my tape to. So it's just another thing that's in addition to help what you're already doing. So this does not take the place of getting the aspiration if that's what you need, or getting your massages, or drinking your fluid, making sure you're doing everything else. This is just like another thing that you could try. So the way that you lay it on, let's see. I usually try to rip the tape at the top of my fingers because it makes things a little easier. And I'm just gonna, sorry. No, I don't have the best camera in the world, but I am not letting that stop me from trying to help some of you guys. So here we go. Just kind of weaving. You know, you might, here I might go that way. Depends on how much other swelling you have, but like to make the basket look nice, that's probably what I would do. But it's probably, let's go that way. So again, I'm going to just rip at the top of the fingers. It'd probably be easier to have somebody else do this on you. Probably if you were laying down, everything would kind of smush out and you could get better access. This is a little tough to do on yourself. So let's see. So we're going to weave. So I'll do one. You can tell I didn't practice this before I decided to show you all. It was just an idea. It's just something that came to mind. So I'm going to pull one and go over it. Then I'm going to go to the other one. We're just pretty much weaving them all together. I've used this over other post-surgical folks after with a lot of bruising and swelling, and it worked really well. You can see plenty of YouTube videos online. I'll wind up posting this to YouTube too, just to see what kind of feedback I get, and who knows who we can help. So we're just kind of running across, and we're just basket weaving everything. The idea is that we're pulling the drainage this way. So if you're doing any of your manual lymphatic drainage, if you're doing any self massages, it would be a really great idea to clear the axilla, make sure everything is working. Alrighty. Feel free to drop any questions here. Hi, Tony. Right? You love me. Gotta making things up as I go. All right, so I'm just making a basket weave. So this is just a way. I got one more I gotta get. Not perfect. Let's see, where do we want that guy to go? It could go down. Depends on where you have swelling. So any of this can kind of bring it in. And again, you could wear this under any compression. So if this is your first time trying it, I would probably do the X technique. It's way easier. If you're having somebody else do it to you, you can have them try this basket weave. It's not too bad. It's usually pretty comfortable. The fingers, like these little fingers, tend to get like caught up in stuff more than like the big X. big thing to remember when you're applying tape, there shouldn't be any itching or burning or anything underneath. If that's the case, you might be allergic or having some kind of reaction to the tape. So I've heard some people say they'll put Maalox on the skin and let it kind of sink in first, and then put the tape on. And as far as tension, the tape already has tension in it, so you don't have to pull too much. And if you put the tension in the middle of, like if these are our two ends that we're going to put down, if you put a lot of tension at the end, I've had people have redness and some like skin teary type issues around the end. So keep whatever tension you do put in there, make it in the middle of the tape so that when you apply it down on the skin, so I have tension here, I kind of pulled it to the max or half. I'll put that down, but then when I put the edges down, I just lay it nice and easy. So the tension goes in the middle and not on the ends. So that's how I work with tape. I hope this helps you. If you try it for seroma, I would love to hear from you and hear if you thought that it helped at all. And I look forward to giving you more info. Please, if you have any questions or anything, go ahead and post it. I've been doing Telehealth Tuesday and taking any of your clients or you yourself, go ahead and post up a picture, post a question. I'll feel free to jump on, go live if I can, and let you know what I think. I'm also just promoting a t-shirt that is going to help a friend of mine who lives in the Bahamas. She's a physical therapist. She is a certified lymphedema therapist. She has a practice in the Bahamas. She lives there, her family's there, and they were devastated by Hurricane Dorian. So I'll post a link to the shirt below, and all proceeds are gonna go to Kitty Adderley and her practice and helping them get back on their feet. All right, thanks so much. Thanks for the question. See you guys soon. Bye.